Hello, thank you for attending our presentation on supporting women of color mental health needs in higher education. My name is Chineri Turner, and I currently serve as the Associate Director of Student Engagement and Belonging at Kennesaw State University.
And hello, my name is Mariah Liggins, and I am the Program Director for the John Lewis Student Leadership Pathways at Georgia Institute of Technology.
As higher education professionals, both Mariah and I have a passion for advancing equity in our field, and as Black women, we wanted to focus on something that we have a connection to and can contribute to providing awareness for. So to go into the agenda, before we get into the presentation, we wanted to provide an overview of the presentation. We will start by reviewing our problem and purpose statements, then get into some subtopics, themes, and keywords, review our literature map, and like I said, the themes that we found conducting our research. And then from there, we will discuss implications and applications before we conclude the presentation and wrap up.
Our program of practice is to investigate the corrective measures and impact of diverse support systems, mentorship, peer networks, colleagues, family support, and on-campus resources implemented within higher education to enhance resilience, foster inclusivity, and support mental well-being for women of color. Our topic was inspired by our own professional lived experiences as women of color working within higher education at PWIs within leadership positions, in addition to highlighting the lived experiences of several women of color throughout the field of higher education and addressing the disparities of mental health support for women of color.
The purpose of the study is to explore and understand the unique mental health challenges faced by women of color in higher education settings, and to develop strategies and interventions aimed at providing effective support and promoting their mental well-being. Some of the guiding research questions we use for this topic include: how can universities give more support to female students of color and their mental health? How can universities give more support to faculty and staff, female or women of color as well? What are the gaps in support for women of color in higher education, as well as how are these gaps identified and corrected? How do cultural factors influence the coping mechanisms and mental health strategies women of color use to respond to academic and workplace stressors? And lastly, how do various support systems, including mentorship, peers, coworker, and family support, contribute to the resilience and mental health well-being of women of color in higher education?
Our keywords are listed on the slide. Each one of these keywords is connected to our common themes found throughout each one of our sources. Each word represents a critical element of the treatment women of color face throughout higher education. One of the common themes we found essential throughout the literature was the lack of support for women of color. Throughout the literature, through lived interviews, surveys, data reports, many women of color stated that they were not supported by their supervisors, colleagues, or even peers when seeking mental health support. In some cases, women even reported that they were forced to endure and remain resilient during times where they were experiencing burnout. In some cases, women of color expressed that they were ignored when they were seeking support. So it raised the question, how do women of color maintain resilience in environments in which they are ignored by management? Another critical theme we identified was how prejudice and stereotypes affect how women of color are treated. This theme explores the historical detriment stereotypes have had against women of color and how those stereotypes have shaped societal perceptions of women of color. If women of color are already fighting against historical stereotypes and retaliation rooted in prejudiced behavior, how can higher education institutions work to acknowledge the issues women of color are experiencing and reimagine how cultural competencies trainings are implemented throughout the institution to educate, protect, and create positive change on campus?
Another theme was cultural barriers, which focuses on how cultural factors influence the coping mechanisms and mental health strategies people of color use to respond to academic and workplace stressors. This theme is directly tied to our research question: how do cultural factors influence the coping mechanisms and mental health strategies for women of color, as it explores notions and stigmas that cultural groups have regarding mental health. And then our last theme is the effects of discrimination on mental health. So this theme explores if and how racism, sexism, misogyny, microaggressions, and other forms of discrimination have a detrimental effect on the mental health of women of color. In this theme, it's also important to note that women of color experiencing racism, sexism, or other microaggressions from their mental health providers is a factor in opinions about mental health services and the underutilization of mental health services. While we did not find any contradictory evidence between Mariah and I's research, another important factor that speaks to our problem of practice is the underutilization of mental health resources that are already available on college campuses. An important step would be to ensure the resources that are available are inclusive for all students and faculty and staff, and that there is psychological safety for marginalized students to receive assistance. So we also just wanted to show you all our literature map. So this is our literature map where you can see how our references related to the subtopics and themes.
A step I plan to take in my current position will be to lead community engagement events that focus on mental health support for women of color, collaborating with community stakeholders to raise awareness about the lack of support pertaining to mental health for women of color. It will expand our network and outreach to various women from different backgrounds who may need support. I will also include our students in the advocacy project so they can expand their connections with the community. I plan to continue to host cultural competency workshops, lunch and learns, and equity panels and symposiums. It is essential that higher education professionals continue to educate others on the importance of cultural awareness, implicit bias, discrimination, and retaliation. Working together to find understanding can aid in fostering positive change and creating an actionable plan together.
A step that I plan on taking in my current position that I gathered from this research is collaborating on events that bring awareness to mental health for communities of color and marginalized and other marginalized communities. I am the supervisor for program coordinators that oversee the LGBTQ Resource Center, the Global Village that supports international students, the Women's Resource Center, and the Cultural Awareness Resource Center that supports students of color. Doing a collaborative event that highlights campus resources and even does a step-by-step on how to find therapists that meets their cultural needs would be beneficial. I think it would also be great to offer cultural competency training and workshops to the counseling and psychological department on campus and assist them with connecting with students of color on our campus, since our department already does these workshops.
Throughout our research, we identified specific strategies that highlight actionable plans and initiatives to address stereotypes and self-care and how we can support women of color. In Quay's 2019 strategies for practicing self-care from racial battle fatigue, the research study showed in this study, some participants found that self-care is a temporary fix and it's to a larger issue that is surrounding higher education. And another common theme was to include cultural competency trainings to help with destigmatizing mental health and conversations surrounding well-being.
So here are also some specific strategies that came from Raquel Rice's 2021 research study that interviewed college students of color on how professionals can assist with mental health so they can create and target programming to students of color to encourage utilization of services, employ employ therapists of color and have them spend time in the cultural resource centers to get to know staff and students, have centrally located offices for students as well as office hours in the student center, host events that promote mental health and wellness with specific intentions to appeal and talk to those of marginalized communities, as well as have modules on mental health for extra credit or a badging system. So while there are a number of trends and topics that have taken the focus of higher education professionals, our topic fuses two important trends of mental health and the importance of equity and inclusion of marginalized students. So we also want to point out the QR code. So the QR code provides our references. And so we hope that you look at them as well as you continue this conversation. Thank you for joining us.
Thank you.